So Leapfrog gave me the title of When Will Healthcare Put Patients First? And I really put us first. Because there's a lot of lip service, honestly, to patients and patient-centered care and patient engagement, and I get confused about what really is patient-centered care. So when Leapfrog invited me to testify, or to present here today, it reminded me of my very first testimony at HRQ when I sat on the very same panel as Leapfrog. It was called the consumer panel, and honestly, I didn't even know what the terminology consumer meant. They called me a consumer, and I was a wife, I was a mom, I was, my family were patients, but I didn't really even understand the terminology consumer. And so I was the first to testify, and then Steve Wetzel from Leapfrog testified right after me. Now this is old footage. Actually, HRQ FedExed this to me on Friday. So I've had to set it up in little frames here, but I want to share the message that Leapfrog and I had 11 years ago about patient safety and the consumer.
Good morning. It's my pleasure to represent the Leapfrog group today. We're sponsored by the Business Roundtable, and we are in an effort to mobilize employer purchasing power to initiate breakthrough improvements in safety and overall value in the national healthcare system. We believe that we have problems with patient safety because we're in a state of gridlock, and that gridlock has been caused by many factors. Purchasers are not buying right. Plans are not letting provider quality show through to consumers. Providers do not see a business case to invest in quality, and consumers and patients with that information, and how we can activate consumers to protect their own interests in the marketplace through the use of data and active advocacy would be very helpful. We would like to learn more.
Another potential area of research includes identifying what injuries and deaths could have been prevented by the implementation of mandatory policies and procedures. My son's injury, kernicterus, is a perfect example of such injury. His brain damage could have been prevented by a simple $27 test. Kernicterus is preventable. Let's prevent it. I sometimes wonder if the government is more concerned about people injured in SUVs or airplanes than they are in hospitals, the one place that we should feel unquestionably safe. Also, the system is confusing and very hard to navigate. How can the system become a more user-friendly system and engage the consumers, physicians, hospitals, media, and agencies? I hope that we all walk away from this summit recognizing that every one of us have the responsibility to reduce medical errors, including the consumer. Consumers need to be more empowered, more informed, and more involved on how to help prevent and report medical errors. And on the flip side, the agencies need to be responsive and respectful of the consumer. This undoubtedly would raise consumer confidence. So that was testimony 11 years ago. Have we made progress? Are we asking for the same today? So after listening to Leapfrog's testimony and my testimony, we are obviously on the same page. We want the implementation of best practices. Consumers believe that when you go to a hospital that they basically follow standards. And I was sharing last night at dinner that when I was 16 and 17, I worked with McDonald's. And actually, I love that job. So in this recession, that's kind of my fail-safe, that I can always go work at McDonald's. But they trained us. Back then, they put us through a 9-week training course. And to this day, I know how to dress a hamburger at McDonald's. And they taught us that there was a bun, there was mustard, there was ketchup, there was pickles, and there was onion, in that order, because the mustard had more starch in it and it prevented the liquids from the others to seep through and make a soggy bun. I learned that when I was 16, and they shared that every McDonald's in the world dressed their hamburger the very same way, in China, in Spain, in Argentina, in the United States. So as a consumer, I expected that there were standards that all hospitals followed. I thought there was somebody in charge of patient safety. I thought there was an FAA of our healthcare system. And Leapfrog and I were on the same page, and we still are on the same page about that. Transparency of quality indicators. I thought also there was a way that we could evaluate and compare hospitals. Well, I learned after I testified, I was kind of Pollyanna, and I believed that there was this ideal system that didn't exist. Then the role of the consumer. How do we engage the consumer to make them more informed decision makers? How do we bring them into the loop? How do we tap into their hard-won knowledge? It's a rich resource that our healthcare system has failed to utilize as a transformer in healthcare.